what I'd like to do is just introduce you a little bit to the existential approach and existential therapy, and just say a little bit more about it. As I was saying before, there's a real diversity in the existential therapies. John Norcross, and these slides, as Ravi was saying, will come out to you, but it really does mean different things. And of course, that's true in any approach. So, psychodynamic approach, you've got the classical approach and the relational approach and object relations, and there's been splits, and person-centered has lots of different tribes, and Gestalt therapy has more relational approaches to, all these therapies have different branches. But the existential approach is, I think, more diverse than most, because it doesn't have any founder. At least like if you look at the person-centered approach, you've got Rogers, or psychodynamics got Freud. There's no Rogers in the existential approach. There's maybe 5 or 6 key people. So you've got key people like Rollo May, Frankl, Yalom, maybe Emmy van Derzen. But they're different people who have kind of developed existential ideas